Welcome to Health Matters. I'm Dr. Derrick DeSilva. Esophageal cancer is a tough diagnosis to swallow. While it's a very serious form of cancer, it is a disease that you can overcome if it is caught early. Here to speak on this topic is Dr. Tepler, a gastroenterologist with affiliated Ambulatory Center for Endoscopy located in North Bergen. Welcome once again. Thank you for joining us.
Thank you.
What is esophageal cancer?
Esophageal cancer is a cancer in the esophagus, which is a hollow tube. It's the food pipe. It runs generally from the back of the throat down into the stomach.
Risk factors. Who is at risk for getting or developing esophageal cancer?
Generally speaking, people that smoke or drink alcohol or have had a history of lye ingestion or other type of injury to the esophagus are more predisposed to developing cancer of the esophagus.
And when we talk about, you said the esophagus is a swallowing tube, correct?
Correct.
So difficulty swallowing, is that part of this whole thing also?
Absolutely. That's usually the presenting symptom. Patients usually come to the doctor saying, I'm having difficulty swallowing. It's usually in a progressive manner. It doesn't start off severe, but it gets worse and worse with time to the point where they have difficulty swallowing solid foods.
How is this diagnosed?
The diagnosis is made with endoscopy. And that's where the physician inserts a flexible camera down the patient's throat into the esophagus. He can visualize a tumor, if there is one, and take biopsies. The biopsy specimen gets sent to the laboratory where the diagnosis is made.
And treatment?
Treatment, oftentimes this type of disease is not curable. It requires invasive surgery with removing the esophagus. There is one type of esophageal cancer that can be treatable with, if it's caught early enough, with endoscopy and the resection via the endoscopy or with certain techniques of ablation.
When we talk about this, you know, a lot of people will come in and say, I have difficulty swallowing. From my understanding, presenting with liquid, solids, how do they typically present that way with difficulty swallowing?
Generally, it may start off as a difficulty swallowing solids, but generally it goes down, and the difficulty over time gets worse and worse to the point where they lose weight and can't eat at all.
Thank you very much for joining us. Great information once again. And folks, if you have any health questions you'd like to ask, please head over to my Facebook page and you can post your question there. Once again, thank you so much for joining us here today. Here's a look at this week's Community Health Calendar.